Thank you again. We will see what we can accomplish in the next few minutes. Why study Seventh-day Adventists? The Adventist Health Study. Well, Seventh-day Adventists are generally known for their emphasis on health and personal health. And so there have been a number of studies here in Europe particularly, in the UK, in the Netherlands, in Norway, and showing that there are some differences in terms of longevity, in terms of overall health outcomes. And the overall health outcome that is desirable is one of wellness. The other aspect, as professionals, I think that we need to have an understanding of nutrition, of the nutrients that are essential for good health. But we've got to do that in terms of the foods that we eat. So what foods do we choose in order to achieve the outcome of wellness that we do want to achieve, and see if that will make a difference in terms of longevity. Now, there have been several Adventist health studies that have been conducted. First of all, beginning in 1958 with the Adventist mortality study. One of the reasons that Seventh-day Adventists are interested in mortality is that in the 1860s, 1850s, individuals who were involved in teaching would be trained, and shortly afterwards they would die. Do you have any idea what the lifespan in the United States was in the 1860s? Less than 40 years. Less than 40 years. And so as a result of that, what can we do to increase longevity? And so this is really one of the aspects. What is the average lifespan in Romania today? Any idea on any part of the view? 70s? It is interesting to look at the difference in mortality rates in various countries. In Western Europe, Central Europe, we're seeing increases in these levels of longevity. And a lot of that is a result of the kind of diet, the kinds of foods that we are eating. And so the Adventist Health Study 1 was conducted from 1974 to 1988. And so I'm going to report some of the results from that, as well as some preliminary reports from Adventist Health Study 2, which began in the year 2002 and continues to the present. And they were recently refunded by the National Institutes of Health for another several years of studies. So let's take a look. Seventh-day Adventists are known particularly for advocating a vegetarian diet. But as we look at Adventist Health Study 2, we do not find this really to be the case. There are, in terms of total vegetarians, 8% of population of Seventh-day Adventists and population in this Adventist Health Study are total vegetarians. Lacto-ovo-vegetarians are 28%, and then non-vegetarians are 48%. That's almost half of the population being studied are not Seventh-day Adventists and are not vegetarian. So let's take a look briefly at just the life expectancy studies that have been done in terms of the findings. You see on the right-hand side the AHS population, and coming down on the left side the population of the general population of California. And so the peak here is at about 80%, at 80 years of age, as being the point at which many individuals are dying, though there are an increasing number of individuals who are living to 100 and above. I have a friend in Loma. His name is Herb Wiles. He's 101. He just went to the driver's license bureau, got his driver's license renewed for another 5 years. So if you come to Loma Linda, be careful, because Herb will pass you. He'll take good care of you, though. He will not hit you. He's a wonderful, wonderful individual. We see a similar pattern with women, though the differences between the age at death of the individuals in the population and the California general population are much narrower. So we see a longer lifespan, almost up to 9.7 years longer lifespan in men than in women. So Adventists in California at least have a dramatic extension of life expectancy. And what causes death? Well, they're the same diseases that the rest of California enjoys, but they really do not impact early death. But when this population dies, it is no different really than the others in terms of cancer, heart disease, and the other leading causes of death. But we're going to look specifically this morning now at the effect of diet on chronic disease, particularly cancer associated with heart disease and cancer of different characteristics that we'll look at in just a moment. But let's first of all begin looking at the relative risk of fatal ischemic heart disease by looking at the amount of beef that is consumed. And so looking at men, the relative risk of individuals who are vegetarian not eating beef have a relative risk of 1. But by increasing that consumption to 3 times per week, it almost doubles to 1.93. And in terms of increasing it to more than 3 times per week, we see 2.31 as the relative risk for men. But we have a conundrum here in terms of women, in that beef seems to be a protective agent in terms of the risk of fatal heart disease. So this is probably not a reason to adopt a beef-based diet for women, but it is a finding of this epidemiological study. And then let's look at it in terms of nut consumption. I've been involved a slight amount of time with the almond study, the walnut study, and definitely the pecan study. Now, the risk of a myocardial infarction for those individuals who have nuts more than 1 time per week has a relative risk of 1, as you see. But by increasing the consumption of nuts up to 5 times, we see almost a 1/2 reduction in terms of the amount of heart attack, myocardial infarction. And then in terms of looking at it in terms of fatal heart disease, increasing the consumption of nuts is very, very similar in terms of 0.52. There's certainly a reduction in the amount of incidence of fatal heart disease. One of the things that we may ask about nut consumption is this really a good thing in terms of the high level of fat that is consumed, that is contained in the nuts? Well, the studies that were done at Loma Linda showed that on an isocaloric diet, including about 100 grams of nuts in the diet per day, those on the nuts actually they lost weight on 100 grams of nuts, as included in part of a general diet that was designed to reduce cholesterol in the first place. And so the addition of nuts to the diet reduced the incidence of heart disease and reduced the levels of cholesterol in the blood. So a summary of this part indicates that beef consumption increases the risk of fatal ischemic heart disease in men. Higher frequency of nut consumption reduces the risk of incident ischemic heart disease, and that fruit consumption is protective against lung and ovarian cancer. Now let's spend a little bit of time looking at the incidence of cancer that was found in Adventist Health Study 1. So the cancers that we're going to look at specifically are colon cancer, breast cancer, and prostate cancer. First, to colon cancer. The addition of fruit, vegetables, and grains to the diet indicated a 40% reduction in the risk of colon cancer in both men and women. Individuals who ate beans at least 2 times per week had a 42% lower risk of colon cancer than those who ate beans less than once per week. And a high consumption of cooked green vegetables, brown rice, dried fruit, and legumes were linked to a decreased risk of colon polyps, a precursor of colon cancer. Individuals who ate meat several times each week had a 60% higher risk of colon cancer. Meat, however, was not associated with an increase in breast cancer nor prostate cancer. I think that is an interesting observation. Particularly now in looking at breast cancer, there were no significant associations that were found between food consumption and the incidence of breast cancer. The one factor that was most common in terms of indicating the risk of breast cancer was the fact that the mother also had breast cancer. Those also who had given birth at an earlier age or had experienced menopause at a later age. So there does not seem to be any real dietary association between breast cancer and food. Then in terms of prostate cancer, I think that you may be aware of the fact that a high consumption of tomatoes is protective against prostate cancer. This was originally found in the Adventist Health Study 1. And so it reduces the risk by 40% or more. And this risk is decreased further by the consumption of concentrated tomato products, such as tomato paste and spaghetti sauce and those kinds of food products. And so in summary, as we look at what we can learn from this brief review of the Adventist Health Study, is that we should select a wide variety of colorful fruits, vegetables, legumes, and whole grains prepared as simply as possible, and to minimize the use of refined foods as they continue to contribute to higher weight and an increased body mass index. Thank you very much. Short and to the point. Thank you.